Confucius stated, "Give a hungry man a fish, he'll eat for a night. Teach a hungry man how to fish, he'll eat for a lifetime." Even in the early days of Confucius, people knew that education was key in maintaining life and successful living. If a patient were to come to the emergency room to be treated for a broken leg, and you were to fail to ask them about their support system, their home life, and their willingness to participate in their own health care, they could get home, fall, become malnourished, suffer from other self-care deficits, and other devastating health problems. Having been in home health for over a year and a half, I've seen patients that have went home with big wounds and casts and crutches and not been taught how to use them, and especially medications that they've not been taught about, which is devastating to their health. In this speech, I'll inform you about involving the patient in their own health care in order to increase their quality of life. Today, I will discuss assessing the patient, educating the patient, and following up on their patient care. First, we will discuss assessing the patient. A patient support system and home life are key to include in your assessment. If a patient happens to have a bone sticking out of their skin, of course you attend to that first, but you need to make sure that you address their home life and what they're going home to, their support system, if someone is willing to help them if they fall, if someone can cook for them, their transportation, their mobility, things of that nature. Attempt to assess the patients related to the likely health condition upon discharge. If you know a patient's going to go home in a cast, you need to assess their mobility in the home, clutter, pets, things that they may trip over. If you were to send a patient home in a cast, you need to make sure they're able to walk through their own home and take care of themselves. Ask the patient how involved they are willing to let you be. Some may be uncomfortable with the questions you're going to ask, and they may think you're trying to pry into their lives in order to get them in trouble. You'd be surprised how many people get paranoid when you try to pry into their home lives. If you let them know what these questions are going to do and how you are going to help them, they may be more willing to answer truthfully and fully and let you know what they are actually going home to. Now that I've discussed assessment, I will discuss patient education. It's easy to get in a hurry and try to discharge your patient. We all know this. We work 12-hour shifts, maybe 8-hour shifts. You're on your feet all day and you're tired. You're ready to go home. But if you don't educate the patient, you're in turn going to make more work for yourself because the patient's going to be right back in that doctor's office or hospital for that education or for another health problem that they've suffered because you didn't educate them in the first place. A study was done by Mike Crawford about involving patients in their own health care. Out of 154 people who replied, 75% said that they had improved the quality of health services, and 46% said that it had led to improvements in people's health. This is big. This states that if you are involving the people in their own health care, they are more likely to succeed. Try to put yourself in the patient's shoes. Assess their readiness and willingness to learn. Also assess the literacy. If they don't understand you, you're not going to get anywhere. When educating, try to show them what to do and then make them do a return demonstration. That way you know that they did understand. And if they didn't, don't make them feel ashamed. Go over it again. It takes a matter of seconds. Take what you learned from your initial assessment and educate them related to what you found. If they state that they have a lot of clutter at home, such as simple throw pillows like this, and you send them home in crutches or a cast, they're going to fall over this and break their neck. Educate them on medications that are prescribed. This is huge. If you're sending somebody home on blood pressure medicine, blood thinners, stuff that could kill them if they take too much of it, they need to know what they're taking so that they know what to watch for. If they don't know the signs of an allergic reaction, they're not going to know, and they're going to continue to take this medicine and possibly hurt themselves. Blood pressure medicine, if they take too much of that, bottom out their blood pressure, they could potentially die. Especially diabetes medicine. If you bottom out your blood sugar, you will pass out, and if they have no one there to take care of them, then they could potentially die as well. A study was done in England that concluded that only 43% were fully informed about their medicine. 33% stated they were partially informed, and 22% said they had no idea what we were talking about. That is ridiculous. That is how people are overdosing. They're not having control over their blood pressure. They're bottoming out their blood pressure. They're bottoming out their blood sugar. It's crazy not to tell people about their medicine. That could kill a person. Following up with patient care is also important. Now that we've discussed education, we'll go into following up with them. If you refer a patient to healthcare agencies or wound care or things of that nature, you have to follow up and make sure they're actually doing this. If you have a person with a big wound and they're not taking care of it, they're going to get staph, they're going to become septic, and they could potentially die as well. Self-care is an important aspect of everybody's life, and losing the ability to take care of yourself is devastating. The Department of Health defines self-care as the activities that enable a person to deal with the impact of long-term condition on their daily lives, dealing with the emotional changes, and maintaining those things that are important to them, such as socializing, family, and work. People may not want to try to take care of themselves because it hurts or they're scared. You cannot let them become dependent upon help. You have got to instill a feeling of being proud of themselves when they do take care of themselves. You have to make them try. If you let them lay in that bed and you don't make them get up, they're going to become bedridden and they'll never get up. It's also important that you make sure they're confident and that they are proud, because this can maximally make them succeed in getting better, and it can get them back to where they were in the beginning. Getting the patient back to their maximum function at home is our primary goal. In order to do this, once again, instill that confidence. By simply assessing, educating, and following up, you can give a person a chance at getting their life back. In this speech, I've informed you about involving the patient in their own health care in order to increase the quality of life. Maya Angelou stated that people may forget your name, but they will never forget the way you make them feel. If you're able to give a person their life back, they'll never forget the impact you made on them, even if it made you a little bit late for dinner.